Good evening. Welcome to another review class for our very, very hardworking practitioners from the Philippines. Today we shall be reviewing kidney patterns, and let's welcome Sir Mark from Santa Maria, Bulacan. Good evening, Sir Mark.
Good evening po, Doc.
Okay, let's start the ball rolling. What are the kidney empty patterns?
Kapag KIP-TFT patterns po, deficiency to kidney Yang Deficiency, kidney Yin Deficiency, kidney Qi not firm, kidney falling to receive Qi, kidney SS Deficiency.
Okay. Can you tell us what are the kidney empty and full patterns?
Kapag kidney Yang Deficiency, ito po yung water overflowing. Kapag kidney Yin Deficiency, fire blazing po.
Okay. There are two. We have discussed that, no? Yeah.
Yes, Doc.
Okay. Combined kidney patterns.
Kidney patterns po combines, kidney and liver Yin Deficiency, kidney and heart not harmonize, kidney and lungs yin deficiency, kidney spleen yang deficiency.
Kidney yin is the root of what?
Root of liver, heart, and lungs.
Okay, remember that. The liver, heart, and lungs
That is yin.
and on the kidney yin. So if you have kidney yin deficiency, expect issues with your liver, heart, and lungs. Kidney yang is the root of.
Root of spleen, lungs, heart.
Okay, spleen, lungs, heart. General kidney pattern symptoms. General symptoms.
Pag general symptoms po ng kidney is masakit ng likod, backache, tendency to obesity, uh, thinness, kidney, emotional tendency to depression, sexual issue, exhaustion, long protracted problems po, Doc.
Okay. So, ibig sabihin, when you have problems, when you get sick, it takes time for you to recover. Kidney yang deficiency. Can you tell us more?
Kidney deficiency, meron tong lower back pain, dizziness, tinnitus, cold and weakness, cold in lower back, feeling cold, weak legs, bright white complexions, tiredness, abundant urination, infertility, potence, premature ejaculation, slow sperm, loose stools, depressions.
What about kidney yang? What about the presentation? The cause?
Ang cause po nito is yung chronic illness, excess sex, excess physical work, present often by spleen. Yang deficiency may involve from kidney yin deficiency, may induce yang deficiency in the organs. Tongue niya po pale and wet, yung pulse niya po deep and weak.
Okay. How will you treat kidney yang deficiency?
Kidney yan deficiency for treatment. Ito 25 po na environmental kidney, bladder 23, kidney 25 kidney yang, due for strengthening fire or pwede imoxa. Rent for 25 kidney yang and 1 ching moxa. Kidney 3, 25 kidney, kidney 7, specific to kidney yang po do.
Okay. Did you get that? Sir Mark is very ready. Kidney yin deficiency this time.
Pag kidney deficiency is, ito yung dizziness, tinnitus, vertigo. Deficient yung yin niya. Deficient po yung marrow para maano yung utak natin. Makakalimutan po your memory, in the blood, hardness of hearing, night sweat, dry mouth, throat at night, masakit ang likod, bones ache, nocturnal emotions, constipations, dark scanty urine, infertility, premature ejaculation, start depression, slight anxiety, and empty heat po siya, Doc.
What about the causes?
Ang causes nito is due on overwork over several years, excess sex, loss of bloody fluids, blood, chronic illness, deficiency of essence. Ito yung part ng yin. May come from liver yin deficiency or liver blood deficiency in women. May lead to Yin deficiency other organs. Ang tangpo nito is normal color, walang coating. Ang pulse nito is floating empty. Treatment principles, nourish kidney yin po, Doc.
And what are the points?
Ang points po ng kidney yin deficiency, dito yung moxars run 4, kidney 3, tonify kidney, kidney 6, especially kidney yin, tonify and benefits throat, kidney 10, kidney yin tonifications, kidney 9, tonify kidney yin, para sa anxiety tsaka emotional, pag, ayun, pwede yung kidney 9 yun. Spleen 6, tonify kidney and liver para makalma ang isip. Lung 7, kidney 6, pwede kung i-combinations yung renmai, nose-reaching kidney yin po, Doc.
Okay, actually, lung 7 and kidney 6 are the opening and coupled points of the conception vessel of Ranmai. No? Okay. Kidney chi not firm. What are the symptoms?
Ang symptoms po nito is sore and weak lower back, weakness, clear frequent urinations, weak steam urinations, dribbling after urinations, incontinent urine, nocturnal emissions without dreams, premature ejaculations, feeling cord prolapse uterus, chronic white vaginal discharge po, Doc.
What is what are the causes?
Causes po nito yung sa lalaki po, excess sex. Sa babae po, too many children close together, excess physical work, kidney deficiency, sinking chi of kidney from the kidney deficiency. Tampon nito is pale, pulse is deep, weak, especially sa kidney positions niya po, Doc.
So if you have a female patient, if you're suspecting kidney chi not firm, you have to ask how many uh times
Boyfriend,
did she give birth to chill, I have seen one patient, she had 16 kids.
wow, dami.
Yeah, grabe. 16 or 17.
Grabe,
15. If she did not if she did not
grabe.
have menopause, she would still get pregnant. Number 10. Kidney, okay, what is the acupuncture? What are the acupuncture points for kidney chi not firm?
Ah,
Principle.
para ma-establish po yung kidney chi niya, pa-ma-rise yung chi para ma-tonify yung yang kidney niya. Bladder 23, tonify kidney yang, firm chi. Do 4, tonifies kidney yang and Ming Men 4, incontinence excess urine. Kidney 3, tonifies kidney. Ren 4, imamoksa mo yan. Kidney yang, original chi. Ren 6, tonify and firm chi. Do 20, raise chi. Kidney 13, strengthens sperms gate, tonify kidney po, Doc.
Okay, let's now go to kidney failing to receive chi, difficulty inhaling, no? Hmm.
Yes, difficult for inhaling from the kidney and to from the lungs is shortness of breath on exertions, rapid weak and breathing, difficulty inhaling, para sa asthma yan, spontaneous sweat, cold, lime, swelling or pace, thin and body, mental restlessness, lower back ache, dizziness, tinnitus, and urinations.
Causes.
Ang causes nito, namamana to Dok, hereditary lungs, kidney weakness, chronic disease of lungs, deficient in kidney yang, lung chi may lead to this, may lead to phlegm. Yan po, Dok. Yung tongue niya pale, pulse niya deep, weak, and ano po, tight niya.
Okay, so that means you already had lung issues in the past, no? Hmm.
Mm-mm.
Treatment. Yeah. Acupuncture points.
Acupuncture points, palakasin mo yung kidney, receiving yung kidney 7, tonify kidney, kidney 3, lung 7, kidney 6, open directing vessels, stimulate descending lungs, chi and kidney, reception of chi, benefits throats, SI 36, tonify chi in general, bladder 23, duo for kidney yang, Ren 6, imomoksa mong kidney yang, throat chi down to the abdomen, Ren 17, tonify stimulates descending of lungs chi, bladder 30, tonify lungs chi.
Okay. Directing vessel is the conception vessel, okay? Or the Ranmai. Next, kidney essence deficiency symptoms.
Pag sa bata po, Doc, is poor development, kanyang fontanelles, deafness, mental dizziness, retardation. Sa pag-adult naman po, softened bones, weakness, legs, poor memory, loose teeth, premature, na tumatanda siya, hair falling out, weak sexual activity, lower back ache, infertility, sterility, dizziness, tinnitus, deafness, blurred vision, absence, mindness po, Doc.
Etiology or causes.
Ang causes nito, Doc, ay yung namamana din sa kidney niya essence, naman sa mga magulang niya, excess sex, lost blood, children, normally kidney backgrounds to young po, kidney yin yang, deficient liver blood, deficient woman po. Ang kanyang dila po is no coating po siya, Doc. Tapos yung pulse niya po is floating empty upper letter po, Doc.
Okay, so you should always consider yin deficiency if there is no coat, no? And if
Yes,
the
Doc.
tongue is pale and swollen, think of yang deficiency. Okay, how are we going to treat?
Treatment principles natin po para sa essence ng kidney deficiency. Ito tonify natin yung yin and essence, kidney 3, tonify essence, kidney 6, friend 4, kidney 30, tonify essence, bladder 23, tonify kidney, do 14, tonify yang aspect of essence, do 20, stimulates marrow to fill brain, bladder 15, tonify heart to house mind, tonify brain po natin, Doc.
Okay, let's go now to kidney yang deficiency, water overflowing, yung may edema. What are the other signs and symptoms?
Meron po siyang edema sa leg and ankles, cold feeling legs and back, fullness and distension of abdomen, sore lower back, feeling of cold, scanty, clear urinations, water overflowing the heart, palpitation, breathlessness, cold hands, overflowing sa lungs po, thin watery, forty sputum, cough, asthma, breathlessness on exertions po, Doc.
Okay, so if you see these patients, it's like, who knows the ba? Let's hope for the best, no? If we get assigned to hospitals, the ba, Sister Rosa, we will actually learn how to evaluate patients, no? Like if you have water that is overflowing to the heart, you will have to watch out for these symptoms, palpitations, breathlessness, and cold hands. Okay, so that means you
Yes.
still have edema. Then you would like to know where, which organ is already about to be affected or has already been affected. If it is overflowing to the lungs, of course, there will be cough, thin, watery, frothy sputum, and also asthma, breathlessness on exertion. Okay, what is the etiology of kidney yang deficiency, water overflowing? Hello? Okay, I think he got lost. Okay, yeah, the cause would be excess raw food, no? So we should not eat too much raw food. Exercise, too much sex, heredity. You see, I have one patient, he owns a gym, no? And he even won a title, uh, bodybuilding title, whatever. But he has so many complaints, okay? And yeah, these are his complaints. So that and he had swollen ankles. Can you imagine? See, too much exercise is bad. So the tongue is pale, swollen, wet with white coat. The pulse is deep, weak, slow. Treatment principles: tonify and warm the kidneys, transform water, warm and tonify spleen yang. So if the water is overflowing to the heart or lung, you have to tonify the heart and lung qi. So the points are do for this will strengthen the Mingmen fire and promotes the transformation of water. Bladder 23 for kidney yang, no? Bladder 22, this is called the Santiao Bakshu to transform fluids in the lower burner. Bladder 20, you have to do moxa in bladder 20 to improve the spleen yang. Spleen 9 and spleen 6 to resolve dump in the lower burner. Kidney 7 for kidney yang to resolve the edema. So what we wouldn't like to happen is a patient with edema already. So you should learn how to do you have to prevent this from happening. 214 direct moxa to tonify the heart. Um, Actually, when you moxa do 14, you can also improve the memory. Now it tells us that the heart and the kidneys can actually uh, assist the brain. No, bladder 15, the bakshu of the heart, you have to do moxa there. Lung 7 to stimulate lung function of dominating water passages to resolve the edema. Bladder 13 for the lung qi. Now let's go to kidney yin deficiency, empty heat blazing. This is the severe late stage yin deficiency leading to pronounced empty heat. So you expect malar flush, mental restlessness, insomnia, night sweat, low grade fever, afternoon fever, 5 palm heat. These are what we call the empty heat symptoms. There will also be dizziness, tinnitus, hardness of hearing, lower backache, nocturnal emissions with dreams, excess sexual desire, dry stools. And so the causes, it always arises from kidney yin deficiency. This is the end result pattern. Extreme heat can lead to bleeding. So when you look at the tongue, it is red and peeled, no coat, and it can be cracked with a red tip. Pulse is floating, empty, and rapid. So treatment principle, nourish the kidney yin. So the points, kidney 3 to tonify the kidney, because that's the yang source point of the kidney. Kidney 6 and 10 to tonify the kidney yin. Kidney 9 for the yin, and it also calms the mind. Remember, this patient is so deficient in kidney yin, so you use a lot of kidney points. And run 4 to tonify the kidney yin, calm the mind. Spleen 6 to tonify the kidney yin, calm the mind as well. Heart 5 and lung 7 to conduct heat downwards away from the heart, no? From the heat where it disturbs the mind. Okay? So, as much as possible, we want the heat to go down to be able to warm the kidneys, not upwards. So, you use heart 5 and lung 7, and of course, Li 11, because there is interior heat. This can clear the heat. Now, for kidney and liver yin deficiency, we have combined symptoms. The key symptoms are dry eyes, dry throat, backache, tongue, no coat, scanty menstruation, night sweat. Tongue will be of normal color, rootless coat. Pulse is floating and empty. Treatment principle, nourish kidney and liver yin. So, kidney 3, kidney 6, liver 8 to tonify liver blood and liver yin. Ran 4 to tonify the kidney, liver yin, and kidney essence. Bladder 23 to tonify the kidneys. Spleen 6 to nourish the liver and kidney yin. And then the last pattern, kidneys and heart not harmonized. So here we have a kidney yin deficiency that failed to nourish the heart yin. So what happens? Your heart yin becomes deficient. This also leads to heart empty heat. Key symptoms, palpitations, tinnitus, night sweat, red tongue, redder tip, midline crack, no coat. So the etiology of kidney and heart not harmonized, I'm sorry, the other signs, the tongue signs, red with redder tip, no coat, midline heart crack. Pulse floating empty and rapid or deep weak on both rear positions. Okay. Relatively overflowing front position. Why? Because the lung and the heart are so overwhelming. Treatment principles, nourish the kidney and heart yin, clear the heart empty heat, and calm the mind. So the points, heart 7 to calm the mind, bladder 15 to calm the heart mind, kidney 3, 6, 9, and 10 to tonify the kidney yin. So many kidney points. Kidney 9 to calm the mind, run 4 to nourish the kidney yin and essence, and conducts the heat downwards. Spleen 6 nourishes the kidney yin, calms the mind. Okay, I think this is still, yeah, two more patterns. I'm sorry. Kidney and lung yin deficiency, came symptoms, dry cough, tinnitus, snow coat, night sweat, malar flush. Yin deficiency leads to body fluid exhaustion, hence dryness. The tongue is red without coat. The pulse is floating empty and slightly rapid. Treatment principles: nourish the lung and kidney yin, nourish the body fluids. So we needle kidney 3 and 6 to nourish the kidney yin. Lung 7 and kidney 6 combination, if you remember, uh, this is used to open the conception vessel, benefit the throat, stimulate kidney reception of qi, tonify lung and kidney yin. Ran 4 and kidney 14 to nourish the kidney yin and essence. Lung 9 and 10 to nourish the lung yin. Spleen 6 to nourish the kidney yin and promote fluids. And finally, we come to the last pattern, which is also very common, no? Kidney and spleen yang deficiency. If you palpate the limbs, they're cold. It is always a chronic condition because it started from spleen yang deficiency. And the key symptoms: lower backache, feeling cold, loose stools, deep, weak pulse. The tongue is pale and wet. Pulse is deep, weak. Treatment principles: tonify and warm the spleen and kidney yang. So this is where you have to moxa all the points. Bladder 23, do 4, ran 4, ran 6, kidney 3, kidney 7, ran 12, stomach 36, spleen 3 to tonify the spleen yang. Bladder 20 and 21 for the spleen yang. Stomach 25, for diarrhea. Okay. Bladder 25, the Bakshu point for LI or large intestine to stop the diarrhea. Thank you so much for joining, and we hope to see you again next time.